Have you ever woken up in the morning, felt tired for no clear reason, and wondered, is my body actually cleaning itself the way it's supposed to? Because here's the uncomfortable truth. Most people never hear from millions of adults, especially after 50. The day doesn't begin with renewal. It begins with silent strain on the kidneys, and you don't feel it until real damage has already started. As a physician, I've seen this pattern again and again. Blood tests that quietly worsen creatinine numbers that creep up year after year, and patients who tell me, "Doctor, I felt fine. I had no warning." That's what makes kidney stress so dangerous. It doesn't scream, it whispers. And by the time it gets your attention, the consequences can be life-changing. But here's where this conversation shifts, because kidney decline is not always inevitable. And the most overlooked window to protect them happens within the first hour after you wake up. In this video, I'm going to show you a simple science-backed morning habit one that supports kidney detox, reduces hidden stress on your filtration system, and helps your body reset from the inside out. It's practical, it's natural, and by the end, you'll understand exactly why how you start your morning can quietly determine where your kidney health is headed years from now. The first thing I want you to understand is this: your kidneys don't start the day at full strength, they start at recovering. Overnight, while you're asleep, your body shifts into repair mode. Blood pressure drops, filtration slows, urine becomes more concentrated, and waste products quietly build up in your bloodstream. So when you wake up, your kidneys aren't refreshed machines ready to work at 100%. They're more like a filter that's been running all night and hasn't been rinsed yet. And what you do in that first hour can either ease that burden or quietly make it worse. I remember a patient in his early 60s who told me, "Doctor, every morning I feel foggy, swollen and slow, but after coffee, I'm fine." On paper, his labs didn't look dramatic at first, but his creatinine was creeping up year by year. What stood out wasn't what he ate all day, it was how he started his mornings. No water, no hydration, just stimulation. And that pattern is far more common than people realize. Many adults unknowingly ask their kidneys to filter thick, concentrated blood first thing in the morning when they're already under strain. From a scientific perspective, this matters more than most people think. Studies consistently show that even mild dehydration increases blood viscosity and raises the workload on the kidney's filtration units called nephrons. When this happens repeatedly, day after day, the kidneys adapt by working harder, not better. Over time, that extra strain contributes to declining filtration efficiency, higher creatinine levels, and increased risk of chronic kidney disease, especially after age 50. This isn't dramatic damage that happens overnight, it's slow, silent, and cumulative. That's why the quality of your first intake in the morning is so important. Before supplements, before medications, before coffee or breakfast, your kidneys need one thing above all else: gentle rehydration that supports filtration instead of shocking the system. Think of it like rinsing a clogged water filter before turning the pressure back on. When hydration is done correctly in the morning, blood flow improves, waste products dilute, and the kidneys can ease back into their job instead of being thrown into overdrive. Now here's where most people get this wrong. They assume hydration is just about drinking anything, but the form, timing, and sequence matter more than they realize. Some choices help the kidneys flush waste efficiently, while others create short-term alertness at the expense of long-term kidney stress. And this is exactly why what comes next in your morning routine becomes so powerful, because hydration alone isn't the full solution, it's only the foundation. But just knowing that hydration matters isn't enough, because there's another overlooked factor that can either amplify kidney cleansing or quietly cancel it out entirely. Once proper hydration sets the stage, the next decision you make can either help your kidneys gently release what built up overnight or force them to work even harder. This is where watermelon becomes surprisingly powerful and also widely misunderstood. Most people think of watermelon as just a sweet summer fruit, but from a kidney perspective, it functions more like a natural flushing tool, designed by nature to rehydrate, dilute waste, and reduce early morning filtration stress. I often think of a woman I worked with in her late 50s who told me she avoided fruit in the morning because she was afraid of sugar. Her labs showed early kidney strain, nothing severe yet, but trending in the wrong direction. When we reviewed her mornings, they were dry, rushed, and heavy toast coffee, no fluids, no fresh foods. When she cautiously added watermelon a few mornings a week, something interesting happened. She didn't feel spiked or sluggish. Instead, she described feeling lighter, less puffy, and more clear-headed. And over time, her hydration markers and kidney-related labs stabilized. It wasn't magic, it was physiology. Here's why watermelon works so well. Over 90% of it is structured water, meaning it hydrates more gradually than plain liquids alone. That helps dilute concentrated blood and urine after sleep, reducing immediate pressure on the kidney's filtering units. But hydration is only part of the story. Watermelon is also rich in lycopene, a powerful antioxidant, shown in multiple studies to reduce oxidative stress and inflammation. Two major drivers of kidney damage as we age. Oxidative stress acts like rust on the filtration system, slowly impairing efficiency. Lycopene helps neutralize that process before it accelerates. There's another detail most people overlook. Unlike many fruits, watermelon is naturally low in sodium and relatively gentle in potassium when eaten in reasonable portions, making it easier on aging kidneys compared to dense sugary or highly processed breakfast foods. In other words, it supports flushing without overloading the system. This is why timing matters so much. Eating watermelon earlier in the day when your kidneys are transitioning from overnight repair to daytime filtration allows it to work with their rhythm, not against it. If you're wondering how to use it, keep it simple. A bowl of fresh watermelon or a light morning blend with just watermelon, a squeeze of lime, and a few mint leaves is enough. No added sugar, no heavy combinations. Think of it as rinsing the filter before turning the machine back to full speed. And yes, if you've been skipping fruit entirely in the morning out of fear, this is often one of the safest places to start. But here's the critical part most people don't realize. Hydration plus watermelon still isn't the full picture because there's another factor quietly influencing whether your kidneys stay protected or become inflamed as the morning goes on. And this next piece is where many well-meaning routines unintentionally go wrong. If hydration and watermelon help your kidneys flush what built up overnight cranberries play a very different but equally critical role, they protect the pathways that waste has to travel through. Because kidney health isn't just about filtering blood, it's also about what happens after that filtration in the urinary tract. And this is where many people unknowingly run into trouble, especially as they get older. I once treated a man in his late 60s who kept asking why his kidney numbers never fully stabilized, even though he was drinking more water and eating clean. What kept showing up in his history were recurring low-grade urinary tract infections, sometimes so mild he barely noticed them. He assumed they were harmless, but each infection triggered inflammation, forcing his kidneys to work harder and recover more slowly. When we addressed urinary tract protection, not just hydration, his kidney markers finally stopped drifting in the wrong direction. This is where cranberries stand out scientifically. They contain unique compounds called proanthocyanidins, which have been shown to prevent harmful bacteria, especially E. coli, from sticking to the walls of the urinary tract. That matters because once bacteria attach, they multiply, cause inflammation, and can travel upward, placing additional stress on the kidneys. Multiple clinical studies have linked cranberry consumption to a reduced risk of recurrent urinary tract infections, particularly in older adults and those with vulnerable kidney systems. But the benefit doesn't stop there. Cranberries are also rich in antioxidants that help reduce oxidative stress and low-grade inflammation, two silent processes that accelerate kidney decline over time. Think of inflammation like friction inside a pipe. It may not block flow immediately, but over months and years, it damages the surface and reduces efficiency. By lowering that inflammatory load, cranberries help preserve the delicate tissues that connect your kidneys to the rest of your elimination system. The key, however, is how you use them. This isn't about sugary cranberry juice cocktails that spike blood sugar and cancel out the benefits. Small amounts of fresh or unsweetened dried cranberries mixed into oatmeal or yogurt in the morning are enough to provide protection without overwhelming the system. Used this way, cranberries act like a shield, quietly reducing bacterial pressure, while your kidneys focus on filtration and balance. And here's the important transition to keep in mind: even if your kidneys are flushing better and your urinary tract is protected, there's still one more internal factor that can quietly undermine all of this if it's ignored. Because detoxification isn't just about water and bacteria, it's also about the chemical environment inside your body itself. But just knowing this still isn't enough because there's another hidden factor that may be even more dangerous if you overlook it. By this point, your kidneys are flushing more efficiently. Your urinary tract is better protected. But there's still a deeper layer. Most people never consider the chemical environment your kidneys are working in. Because even with good hydration and the right fruits, if that internal balance is off, your kidneys are forced to compensate. And this is exactly where lemon quietly becomes one of the most underestimated tools in morning kidney care. I often hear patients say, "Dr. Lemon is acidic, won't that be harsh on my kidneys?" And I understand the concern. One of my patients, a retired engineer in his early 70s, avoided lemon completely after being warned about kidney stones years earlier. Yet his labs kept showing concentrated urine and a slow upward drift in stone-forming markers. When we revisited the science together and he cautiously added warm lemon water to his mornings, his follow-up results surprised him. Urine volume improved, stone risk markers decreased, and he felt less heaviness through the day. The mistake wasn't lemon, it was misunderstanding how the body actually processes it. Here's the science that changes everything. While lemon tastes acidic, once metabolized, it has an alkalizing effect inside the body. This matters because overly acidic internal environments increase calcium crystallization and reduce citrate levels in urine, two key contributors to kidney stone formation. Lemons are naturally rich in citric acid, which increases urinary citrate, a compound shown in clinical studies to inhibit stone formation and support smoother waste elimination. In simple terms, citrate acts like a protective buffer, keeping minerals dissolved instead of letting them clump together inside the kidneys. Vitamin C plays a role too, but not in the exaggerated way social media often claims. In moderate food-based amounts, vitamin C supports antioxidant defense and helps reduce oxidative stress inside kidney tissue. Combined with warm water, lemon gently stimulates digestion and encourages early morning urine flow, helping the kidneys clear concentrated waste before the day fully ramps up. This is why timing matters so much. Using lemon first thing in the morning works with your body's natural detox rhythm, not against it. The solution doesn't need to be complicated. Half a fresh lemon squeezed into warm water, sip slowly after waking is enough. No sugar. No extremes. Think of it as setting the internal chemistry so your kidneys don't have to fight against imbalance all day long. When used correctly, lemon doesn't stress the kidneys, it actually reduces the conditions that cause long-term damage. But here's the turning point. Most people still miss hydration. Watermelon, cranberries, and lemon only reach their full power when they're used in the right sequence. Because even healthy tools, when applied in the wrong order, can lose their impact entirely. But just knowing this still isn't enough, because there's one final factor, rarely discussed, that can quietly determine whether your kidneys stabilize or continue to decline despite your best efforts. At this stage, everything we've talked about, hydration, watermelon, cranberries, lemon, starts to converge into one critical truth most people never hear. It's not just what you consume, it's the order you consume it in. I've seen patients do all the right things, eat all the right foods, yet their kidney markers barely move. And when we look closely, the problem is almost always sequence. The kidneys are rhythmic organs. They respond to timing, flow, and progression. When you disrupt that rhythm, even healthy choices lose their power. I think of a patient in her early 60s who was genuinely doing her best. She drank lemon water, ate fruit, even avoided processed foods. Yet her creatinine remained stubbornly high. When we mapped her mornings minute by minute, the issue became obvious. Everything was happening at once. Lemon water rushed down, fruit piled on top. Coffee followed immediately. Her kidneys were being asked to filter buffer acid, manage sugar, and handle stimulants simultaneously. Once we slowed things down and introduced a simple sequence, her body finally responded. Not dramatically overnight, but steadily, predictably, the way healing actually works. Here's the science behind why sequence matters. Overnight, your kidneys conserve water and concentrate waste. In the morning, they need gentle dilution first, not stimulation. Warm lemon water comes first because it increases urine volume, raises urinary citrate, and prepares the filtration system chemically. Then watermelon follows, providing structured hydration and antioxidants that further dilute waste without spiking stress hormones. Only after that does cranberry belong, acting as a protective layer for the urinary tract, while filtration is already flowing smoothly. This progression reduces nephron strain, supports blood flow, and aligns with circadian kidney function shown in multiple physiological studies. Think of it like restarting a long-running machine. You don't slam it at full speed. You warm it up, flush the system, and only then let it run. When this sequence is followed consistently, patients often report less morning puffiness, clearer thinking, improved urine color, and over time, more stable lab trends. This isn't a detox myth. It's a systems-based approach that respects how the kidneys actually work. And here's where this becomes deeply important. When people skip sequence, they often assume the solution is more supplements, more pills, more restriction. But in reality, it's usually about less force and better timing. The kidneys respond far better to rhythm than pressure. That's why this morning reset works quietly without extremes, without shock, and without fighting the body's natural design. But just knowing the sequence still isn't enough, because there's one final factor rarely discussed, often underestimated, that can quietly determine whether all of this becomes a turning point for your kidneys or just another routine that fades without results. Everything we've discussed so far, hydration and watermelon, cranberries, lemon, and the correct morning sequence can support your kidneys in powerful ways, but there is one final factor that quietly overrides all of it if you ignore it. And this is where many well-intentioned people unknowingly sabotage their progress. That factor is what you introduce immediately after this reset, especially stimulants and stress triggers that force the kidneys back into emergency mode. I've had patients follow the entire routine perfectly, only to undo the benefits within minutes. One man in his late 50s told me, "Doctor, I do the lemon water, the fruit, everything you said, then I grab my coffee and rush out the door." His labs never improved. Why? Because caffeine and stress hormones surge together, tightening blood vessels, increasing blood pressure, and signaling the kidneys to conserve fluid again. In simple terms, the kidneys go from recovery mode straight back into defense mode, and the reset never gets a chance to settle. The science here is very clear. Acute caffeine intake increases cortisol and temporarily raises blood pressure, both of which reduce renal blood flow in susceptible individuals. Combine that with morning stress, rushing, skipping meals, dehydration, and you create a biochemical environment where filtration efficiency drops again. Studies show that repeated spikes in sympathetic nervous system activity can worsen kidney perfusion over time, particularly in adults over 50 or those with borderline kidney function. This doesn't mean coffee is bad, but timing is everything. The solution is surprisingly simple, and this is what I want you to really hear. Give your kidneys a buffer window. After completing your morning reset, wait 30 to 45 minutes before caffeine. Breathe. Eat calmly. Let urine flow normalize. This short pause allows the kidneys to finish flushing, diluted waste stabilize blood chemistry, and lock in the benefits of everything you've just done. Patients who respect this window often notice less jitteriness, steadier energy, and over time more stable kidney markers. This is the difference between a routine that looks healthy and one that actually changes outcomes. Small timing decisions create big physiological consequences. Your kidneys don't need forced supplements or fear they need protection, rhythm, and consistency. When you honor that, you give them a real chance to recover instead of just survive. But just knowing this still isn't enough, because the final step isn't about food or timing at all. It's about the mindset that decides whether you stay consistent long enough for your kidneys to truly heal. If there's one message I want you to take with you today, it's this: kidney health is not lost overnight, and it's not restored overnight either, but it can be protected with small, consistent choices. You don't need extreme cleanses or complicated protocols. What truly matters is understanding your body, respecting its rhythm, and giving your kidneys the support they quietly ask for every single morning. If this video helped you see your routine in a new way, I encourage you to save it so you can come back to these steps and make them part of your day. And if you care about protecting your kidneys, lowering creatinine naturally, and aging with strength instead of fear, make sure to subscribe to the channel and turn on notifications. We regularly share the latest medical insights explained clearly and practically to help you take better care of your kidney health. Most importantly, don't lose hope. I've seen many people stabilize their kidney function and regain confidence simply by starting earlier and staying consistent. You're not too late, and you're not alone in this journey. One calm morning, one better choice, one small reset at a time. This is how real healing begins. Take care of yourself, and I'll see you in the next video.